Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call, and today I'm speaking with Matt Ford, an actor, writer, and video producer in LA who currently has monkeypox. We talk about his experience with the disease, the likely vast undercounting of cases, and stigma towards the LGBTQ community. Let's listen. Matt Ford, thank you so much for being on Public Health on Call. You're joining us from isolation in LA. How are you doing?
I am, yes. First of all, thank you for having me. And I am doing okay. I've certainly been better. Experiencing monkeypox is not fun, but I think thankfully I'm past the worst of it.
So tell us about your experience with monkeypox, the timeline and where you are now.
Yeah, absolutely. So the timeline, tracing it backwards, I believe I was exposed around June 10th that weekend. I first started noticing symptoms and was informed that I had been exposed by someone who tested positive June 17th, so the Friday after. And since then, that weekend, it was the long weekend with Juneteenth, I started experiencing intense flu-like symptoms, fever, chills, night sweats, cough, sore throat, etc. And the week after, those symptoms sort of abated, and then I started experiencing a lot of skin lesions. A lot more of those started manifesting. And it's been kind of a journey since then. Some are more painful or itchy than others, especially if they're in more sensitive areas. I've counted over, more than 25 spots on my body. So it hasn't been fun. I've been to the doctor a couple of times. They have mostly been treating my symptoms, but I haven't been able to get any kind of medication that will actually treat the virus itself. So between that and some of the misinformation going around and the CDC seemingly being slow on handling this, it's been a bit frustrating.
The original symptoms that you described could also be COVID. So if someone hadn't informed you that you tested positive, how would one tell that, you had monkeypox versus COVID at that stage?
I would have never known. I would have thought I had the flu or COVID or something, until I noticed the actual spots themselves. That seems to be the main indicator that, oh, this could be monkeypox. But I was fortunate in that I was told on the earlier side, that someone I'd been in contact with had tested positive. So that was very useful for me in quickly identifying it. But otherwise, to your point, I would have never guessed that.
Have you worked with any contact tracers?
I have, yes. I've been in touch with the Los Angeles Department of Public Health. They have been taking information about who all I have been near or could have potentially exposed. And there's been a nurse checking in with me daily.
Did they give you guidelines for isolation, such as when it's okay to leave isolation?
They did, yes, actually. And in LA County, funnily enough, they are issuing court-ordered stay-at-homes for everyone who tests positive. And so with that, they're basically issuing a blanket rule that says unless it's an emergency visit or you're going to the doctor, stay at home and don't be around anyone.
What's the duration?
2 to 4 weeks, but they specify that you are contagious up until the point where all of your spots have scabbed over, fallen off, and there is fresh skin underneath. At that point, you're considered no longer contagious.
Will you have to go back to a doctor at any point?
At this point, I'm hoping not, because it seems like I'm past the worst of it. So I'm mostly just, DMing, messaging with my doctor at this point. I'm hoping I won't have to go back in person.
You posted a monkeypox PSA on social media talking about your experience and how it spreads and all that. And we'll be sure to tag your account in our Twitter post about this episode so that people can find you. Can you talk about what you knew about monkeypox before you had it and where maybe you got some of your information?
I knew very little about monkeypox before I got it. I had seen a couple of articles and tweets, whatever, about it, saying that it was a thing that was happening, but I didn't have any kind of personal connection to it. I didn't know anyone who had it. It seemed like this kind of arbitrary thing to maybe watch out for. Once I got it, that all changed. And once I spoke out publicly about it, I found out that a lot of friends of friends, acquaintances were all DMing me, messaging, saying, I have it. I think I was exposed at this point. So-and-so who we both know has it. It has become very real very quickly. But it was a quick education because prior to getting it, I didn't really know much about it at all.
You mentioned in your PSA that the current numbers that they have for monkeypox, much like COVID outbreak, are probably a vast undercount. And it sounds like in your case, anecdotally, that seems to be true.
Yes, that was something mentioned by my doctor. He said that he thinks it is severely underreported. There was an NPR article that came out that basically said the same thing. And I just recently saw a tweet linking to an article saying that they were testing the viral loads in the sewage in San Francisco. And all this seems to support that there are way more cases than what is currently being, reported on by the CDC.
You also talk about how monkeypox seems to be spreading fastest among queer men, but that anyone can get it. What can be done to lessen the stigma so that we can broaden prevention efforts among other groups?
Yeah, absolutely. So ways I personally think to lessen the stigma is definitely, yes, focusing on the ways it is spread, but not focusing on just the sexual aspect of it. Because, listen, obviously that's one way that it is spreading. Our community, the LGBTQ community, unfortunately, is not new to this, with HIV and past situations that have risen, even currently a meningitis breakout that's happening in Florida. We're obviously aware that things spread, but the CDC has issued specific ways that this can spread that we're already aware of. So yes, that includes sex, but that's also making out with someone. I know someone who got it that way, holding someone's hand, sharing bedding, towels. We know the way it's spread. So I think focusing less on a specific avenue of how it's spread from one person to another and more on the ways it can potentially spread and those parameters is really important. And especially in the language in the media, emphasizing to acknowledge maybe that there could be stigma around this, or at least doing one's part to try to minimize that by emphasizing that this can spread to anyone. A parent could spread it to a child. You could give someone a hug and not know you have a lesion. There are a lot of ways that this can spread.
What do we know at this point about vaccination efforts?
I know that they have developed a new vaccine, but it is a newer vaccine with more updated technology than the smallpox vaccine that they originally were giving. There is a very limited supply of it. They did kind of a surprise drop of it, which I thought was an odd strategy or technique in New York and Los Angeles to people who had potentially been exposed. But those supplies were so low that very few people were able to even get the first dose of it. I believe it's a multi-dose vaccination. So yeah, it's unfortunate that there isn't more of it. We're hoping the CDC ramps that up and that more people that have potentially been exposed can get vaccinated. My understanding of it is that it is effective in not only preventing it, but also if you've been exposed or are starting to develop symptoms, that it can also be effective in perhaps helping to treat it or minimize symptoms.
We are coming to the end of Pride Month, where many people have been celebrating. There were huge concerns about outbreaks. What are things that people should know at this point?
Yeah, absolutely. I think particularly through the lens of Pride Month, and this, as we stated before, seemingly primarily affecting queer men so far, I think just being on top of looking for symptoms and being alert of who you could have possibly come in contact with who could test positive or were exposed is really important. As I mentioned before, there's a lot of different ways it can spread. There are a lot of dance parties over Pride, some with or without shirts on. So, there are a lot of ways that skin-to-skin contact can happen. So I think, especially for the LGBTQ community, it's important to just remain vigilant on any potential symptoms showing up and being on top of it if any do manifest.
Anything else you think people should know about monkeypox?
The most important things I would say to anyone listening about monkeypox is to try, especially if you are exposed or think you might have it, try not to feel terrible. You've done nothing wrong in getting it. There is no shame in it. We're trying to minimize the stigma in it. And the number one thing to remember is that it is temporary. That is the number one mindset gift for anyone going through this. Yes, it could majorly suck. It is not a fun experience whatsoever. It could be quite painful. But at the very least, it is temporary. In a few weeks, you will be on the other side of it and things will be better.
Matt Ford, thank you so much for joining us.
Thank you so much for your time. I appreciate it.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.